website at lowteflorida.com.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to Let's Talk Hormones with Carolyn Zallmeyer. Take some time with me this evening to learn how to age healthier and live happier. Today we'll be discussing how hormones can affect all aspects of your health and well-being. I've been specializing in women's health and hormones for over 28 years and focusing in on bioidentical hormone therapy for both men and women for the past several years. We talk hormones. We don't talk sex. We talk health, aging, wellness, and relationships. And, well, maybe a little bit of sex. So let's get this party started. Good evening and welcome to Let's Talk Hormones with me, Carolyn Zallmeyer. We're live streaming on Facebook, live on WNN 95.3 FM and 1470 AM, and we're also on the iHeartMedia app. During the next 30 minutes, if you have questions for me, you can call in to 1-888-565-1470, or you can send questions through Facebook. We're streaming live. Tonight's topic is testosterone. I love testosterone. It's Testosterone Thursday. Tonight we'll explore testosterone, what it is, where it comes from, some of the benefits of testosterone optimization, and the history of the development of testosterone therapy, and finally we'll dispel 10 common myths for women with testosterone therapy. I've been providing hormone therapy for over 28 years and testosterone therapy for both men and women at LowTE Florida for over 6 years now. I've ranked as the #1 provider in Florida for all of 2018. The response from my patients has been nothing short of incredible. Both men and women produce testosterone naturally. Men mostly in their testicles and women mostly in their ovaries. As we age, we start to produce less and less. Women can start producing less and less as early as in their late 20s, and men as early as in their early 30s. What you might notice as your testosterone levels start to decline, some things might be less energy, more moody, disrupted sleep, weight gain, and especially around the middle, decline in sexual function, desire, sex drive, and sexual satisfaction. What can we do to reverse these changes? At LowTE Florida, we use a BioTE pellet system. The beauty of the pellet system is we can personalize the dose for your body utilizing your medical history and lab values. I insert the pellets, and no, it doesn't really hurt. And over the next 4 to 6 weeks, your testosterone levels will start to rise. And you'll notice little things like your sleep will become more deep and delicious, and your mood may lighten a bit. You may think of sex a little bit more, and when you do have sex, the fireworks may be a little bit brighter. You just feel more like your old self, turning back the clock, maybe 10, 15 years. I was the first BioTE pellet provider here in Florida many moons ago. And the funny thing I noticed was when I was training in Texas, the guys were very open about using testosterone therapy. I would hear them talking at barbecues and parties, hey, what's your number? What are you using? And, what's your dose? So I was very excited to bring this to Florida. However, years ago, when I started speaking to men about testosterone therapy and, checking their testosterone levels, the usual response was, I don't know what my number is, but I'm sure it's just fine. It was almost like I was insulting their manliness. But things have changed. Many men are thinking that when we say low T, that we're thinking about ED. And as your hormones decline, ED is one of the last things you may notice. Before ED, you may notice increased fatigue, and that's the #1 reason people come to see me. Brain fog, may not be thinking as clear as you used to, weight gain around the middle, declining mood, and possibly sleep issues, maybe waking up at 3 in the morning and not being able to get back to sleep. If a male patient mentions ED, I encourage them to see a cardiologist for a full workup. Men with ED issues have a much higher risk of cardiovascular disease. Women were more open to it back then. They were more used to talking about hormones since we were seeing more commercials and articles on hormone therapy for women. But now things have changed. Men are more comfortable talking about testosterone, and they want to feel better. We have a lot more to live, and we want it to be great. More and more men are aging. Over 15,000 of men turn 65 every single day. Our baby boomers are aging, and they want to age healthier and live happier, avoiding over-medication through natural hormone balance. Hey, that's a great name for a book. If you would like a free book written by the founder and CEO of LowTE Medical, Dr. Gary Donovitz, my friend and mentor, go to my website, lowteflorida.com, and we'll send it out as soon as possible. It's a great book, an easy read, and very educational. Most men want to live their lives to the fullest. They don't want to fall into the recliner, grab the remote, grab a beer, sit there and age until they die. The men I see at LowTE Florida want to live life. They want to do things, go out. They want to exercise, do sports, travel, and have excellent relationships and satisfying sexual relations. Anyway, back to testosterone. Currently, there are 7 human clinical trials sponsored by the U.S. National Institute of Health that are assessing the effectiveness of testosterone therapy on men 65 years and older. There's hundreds of studies, good studies, peer-reviewed, double-blind studies showing the safety and efficacy of bioidentical hormones. Testosterone has a direct and indirect effect on every organ system, both in the male and female body. When measuring the total testosterone levels in blood, I found that the numbers don't necessarily correlate with the patient's chronological age. I have men in their 30s with much lower numbers than their fathers who are in their 60s. The general normal range for LabCorp is maybe like 250 to 1250 or even 950. But remember, looking at the labs, normal may not be optimal, especially when you're looking at females' testosterone levels. The normal range for women on our lab reports are created by the lab. There's no textbook normal for women as we age. We know from years of experience the levels of where women really feel well, and we know how to get you there. Many doctors have differing thoughts and opinions on testosterone therapy for both men and women, and I've heard many times that in medical school that it isn't even taught. They may have 1 to 4 hours on endocrinology. That's not enough to really become an expert in hormone therapy. If they're not keeping up with the latest studies, they may not be knowledgeable or supportive of hormone therapy. So remember, if they're not up on it, they may be down on it. With that being said, I do have many physicians that are open and supportive. They refer patients to me, and some are actually pellet patients too. So why do some people have low testosterone sooner than others? Certain chronic disease states can reduce the testosterone levels, such as diabetes, congestive heart failure, hypertension, prostate cancer, HIV, and AIDS. There's many theories on head injuries, exposure to toxins, and more as to why some patients have lower than expected testosterone levels. Cancer. The big myth I have to dispel every day is that testosterone causes prostate cancer. It does not cause new onset prostate cancer. A study published by a faculty member at Duke University, Dr. Coley Carson, a very respected urologist, states there's currently no evidence that testosterone replacement therapy initiates prostate cancer or stimulates a subclinical malignancy to become clinically evident. Meaning, if you've had an undiagnosed prostate cancer and you begin testosterone therapy, it does not make it grow quicker than if you hadn't had the testosterone therapy. In 2017, another study by Dr. Carson was published in the Journal of Clinical Urology, and it reads, "We found that patients who received testosterone replacement therapy treatment did not have an increased risk of overall prostate cancer. A longer duration of testosterone replacement therapy was not associated with a greater risk, and patients who received testosterone replacement therapy had a significantly lower risk of aggressive prostate cancer." So testosterone therapy is basically protective for the prostate. If you think about it, when is a guy's testosterone level the highest? Late teens, early 20s? How many men at the age of 17 have prostate cancer? 0. So high testosterone can't be the cause of prostate cancer. If anything, it's the low testosterone. In fact, many doctors are treating men with prostate cancer with testosterone therapy. Oh, by the way, if you have any questions, you can always call in. We'd love to hear your questions here tonight at 1-888-565-1470. So where does testosterone originally come from in our bodies? In our bodies, it originates actually from cholesterol. And then there's a cascade of enzymes that produce testosterone in our bodies. Cholesterol produces pregnenolone, which then produces progesterone, which produces 17-alpha-hydroxyprogesterone, which produces androstenedione, which finally produces testosterone. That's a big, sophisticated body we have. Who knew that that was going on inside of us to get us our happy hormone, testosterone? Ever wonder how testosterone was discovered and how we started using the term? Probably not, but it's a fascinating story, and I love this stuff. In 1849, Arnold Adolf Berthold, a German physiologist and zoologist, started things off in Germany. Then in 1889, a Harvard professor, Charles Edward Brown Sagard, found testosterone to be a rejuvenating elixir. Then at 72 years of age, he self-injected the extracted magical rejuvenating elixir and then reported his vigor and feeling of well-being was restored. This was 1889. That's quite a while ago. Over the months of May through June of 1889, Sagard injected himself 10 times with this elixir. He reported being able to work on his feet for hours at a time. He also said he could run up and down the stairs to his lab. Objective tests also proved that his arm strength had increased by a significant amount. In 1889 to 1890s, scientists all over the world started hearing about Sagard's incredible discovery. They began to conduct experiments trying to truly discover the elixir of life because they knew that was big. In 1927, the University of Chicago's professor of physiological chemistry, Dr. Fred C. Koch, my great-uncle, can you believe that? Crazy stuff. He and his research partner focused in on isolating and producing testosterone. So you see, my interest in testosterone comes naturally. I didn't have a choice. In 1929, Uncle Fred and Lemieux McGee, his partner, perfected the original technique. Together, they created a much larger quantity of the mysterious elixir and also completed studies on the safety of injecting testosterone into humans. In 1934, 3 European pharmaceutical giants, Schering, Organon, and Ciba, began serious full-scale development and research programs in the 1930s isolating testosterone. In 1939, we have our first study that we can find of using hormone pellet therapy in women after hysterectomies here in the United States. In the 1950s, science discovered a longer-acting form of testosterone which could tailor the effect of the steroid to increase the strength. Testosterone could only be given by injection or by subcutaneous pellet. The hormone was ineffective if it was taken orally. In 1958, the doctors began to inject testosterone into ill patients to help them regain their strength. In 1978, I ran into my first hormone pellet therapy. I was training in surgery in Memphis, and after completing a hysterectomy, we closed the patient up, rolled her over, and inserted hormone pellets in her backside so that when she woke, she wouldn't feel so bad. So why should we optimize our hormones, the elixir of life, for quality of life and good health? Now we're going to roll for just a little break, and then we'll be right back, and we'll be answering your questions. Many men and women are feeling tired, moody, having difficulty sleeping, gaining weight, and have no desire for intimacy or exercise. These symptoms can be caused by reduced levels of hormones that occur naturally as we age. You'll be happy to learn there's an exciting, safe, and natural solution available at LowTE Florida. If you'd like to learn more about how LowTE Florida can safely balance hormones for both men and women, call today or visit our website at lowteflorida.com. You've been listening to Let's Talk Hormones with Carolyn Zallmeyer. I hope I've made you feel comfortable enough to call in with your questions. The phone number is 888-565-1470. Now, let's get back to the show. Many of my patients have noticed the following with testosterone therapy: increased energy and vitality and zest for life. And I keep hearing this one over and over: improved feeling of overall well-being. Well, I got a question that just came in. My doctor started me on testosterone troches 6 months ago, and it is different than what you're talking about? I take one every day. Well, the testosterone troches are different. You put them in your side of your cheek or under your tongue and let it absorb in. And with that, you have the potential to actually swallow it, and that's not good because we don't want it to go through the liver. And so the testosterone troches, you'll have that spike. You won't have the actual balance of the pellet therapy. So what we found is that the levels don't get to the happy level of what we can get with the pellet therapy versus on the troches. Okay, so what we found with our testosterone pellet therapy is that, like I said, the increased energy, vitality, zest for life. We also have depression relief. We are able to actually take some patients off their antidepressants once their hormones are optimized. And the same with anxiety relief. They can stop taking some of their anti-anxiety medications, and that's good. Improve cognitive clarity. A lot of times people think clearer. I had one girl that thought she was actually smarter after her pellet therapy. Improve memory. You'll remember why you walked into the kitchen or where your keys are. And improve focus. I have this one male attorney that I've been correcting for years, and he says that he knows when his pellets are due is when he loses his focus. He'll be working on a project, and his mind is drifting from this way to that way, and this really helps him focus in. Enhance libido. You think about sex a little bit more, and sexual performance can be improved as well. Improve sleep. You'll get that nice, delicious sleep, maybe able to sleep a little bit extra and have a good quality sleep, wake up feeling more rested. Joint pain relief. I have many patients that say that their joint pain is relieved. I had one girl today that was telling me that she had severe neck pain, and since her pellet, she's been able to sleep without her magic orthopedic pillow and has not had any neck pain. So that's big. So for improved health, we have the feel-good benefits, and then we have the health benefits of the pellet therapy. And for improved health, the studies actually show that it's protective for the prostate, that the men that have their hormones optimized have less of an incidence of prostate cancer than those that don't. Same with breast protection. It's actually protective for the breast. Cardiovascular protection, same thing. Less incidence of cardiovascular events in those that have their hormones optimized than those that don't. Increased bone strength. Testosterone is a bone builder. It actually helps rebuild bone. So if you have osteopenia or osteoporosis, rather than taking those horrible chemicals that'll give you all kinds of potential side effects, if we can treat it naturally with actually rebuilding the bone, and so you can age with nice, healthy bones. Increase muscle strength. Over 50, it's almost impossible to build muscle. You may be able to maintain muscle with your workouts, but actually building muscle is almost impossible. If you picture those guys that are like over 50 in the movies that are taking their shirts off, like Matthew McConaughey or Tom Cruise, and they're all ripped, they're taking testosterone. Reduce body fat. We find a lot of people kind of lean out once we optimize their hormones so that they have less body fat, which is a healthier way to age because it's going to help lower your cholesterol, possibly bring your blood pressure down. So if you're on blood pressure medicines, it may be able to reduce that down a little bit. And less medication is better if you can get away with it. So bioidentical versus synthetic testosterone, what's the difference? The chemical molecular structure is the difference. With bioidentical testosterone, the chemical molecule in our pellets is exactly the same as what our body produces. The synthetic testosterone, like androgel or the injectables, has a different molecular structure that doesn't fit into the receptor sites in our cells throughout our body like the bioidentical testosterone does. It's kind of like, I look at it as trying to stick a square peg in a round hole with the synthetic hormones, where the bioidenticals fit into the receptor sites like a lock and key fashion. The testosterone in our pellets is used by over 3,000 BioTE providers throughout the country and is derived from wild yams. It's then processed into powder testosterone and compacted into pellets in a 503B compounding pharmacy with FDA oversight. One pellet out of every batch created is sent to an independent lab and is tested 8 different ways for sterility, strength, compactedness, weight, etc. If any of those measures are not met, it's rejected by BioTE and sold off to someone else. I recently ran into a fabulous article written by Dr. Rebecca Glazier, a very well-respected hormone researcher, in 2012 titled "The Top 10 Myths About Testosterone in Women." Myth 1, testosterone is a male hormone. Even in the science publications, testosterone has been referred to as a male hormone. Men do have a higher circulating level of testosterone than women. However, women's testosterone is the most abundant sex-active hormone in women throughout the female lifespan. Testosterone is measured at 10-fold higher units than estradiol. So it's 10 to 1 testosterone to estradiol. The fact is, testosterone is the most abundant biologically active hormone in women. Myth number 2, testosterone is the only role of testosterone is for women's sex drive and libido. Despite many recent publications, testosterone's role in sexual function and libido is only a small fraction of the physiological effects of testosterone in women. Functional testosterone receptors are located in almost all tissues, including breast, heart, blood vessels, gastrointestinal tract, lung, brain, spinal cord, peripheral nervous system, bladder, uterus, ovaries, endocrine glands, vaginal tissue, skin, bones, bone marrow, synovium, muscle, and adipose tissue. The fact is, testosterone is essential for a woman's physical and mental well-being. Myth number 3, testosterone masculinizes females. It's been recognized for over 65 years that testosterone effects are dose-dependent, and in lower doses, testosterone actually stimulates more femininity. Although large doses of testosterone are used to treat females and male transgender, patients may result in facial hair growth, hirsutism, and a slight enlargement of their clitoris. True masculinization is not possible. Fact, outside super huge doses of testosterone does not have masculinizing effects on females. Myth number 4, testosterone causes hoarseness and voice changes. Hoarseness is common, affecting more than 30% of people at some point in their life, with 6.6% of the adult population affected at any given time. Hoarseness is more prevalent in women than men. Most common causes of hoarseness are inflammatory-related changes due to allergies, infectious or chemical laryngitis, reflux esophagitis, or voice overuse, that's mine, mucosal tears, and medications, and vocal cord polyps. There's no evidence that testosterone causes hoarseness. In addition, there's no physiological mechanism by which testosterone could be expected to do so. Testosterone deficiency is listed as a cause of hoarseness. The fact is, there is no conclusive evidence that testosterone therapy causes hoarseness or irreversible vocal cord changes in women. Myth number 5, testosterone causes hair loss. There's no evidence that testosterone or testosterone therapy is a cause of hair loss in either men or women. Although men do have higher testosterone levels than women, men are more likely to have hair loss with age. It is unreasonable to assume that testosterone causes hair loss. The fact is, testosterone therapy increases scalp hair growth in women. Myth number 6, testosterone has an adverse effect on the heart. Men have higher levels of testosterone than women. Men have higher incidence of heart disease. However, it's illogical to assume that testosterone causes or contributes to cardiovascular disease in either sex. Unlike anabolic and oral synthetic steroids, there's no evidence that bioidentical hormones have an adverse effect on the heart. In addition, it is not physically possible. There is overwhelming biological and clinical evidence that testosterone is cardioprotective. Testosterone has a beneficial effect on the lean body mass, glucose metabolism, and lipid profiles in men and women, as it has been successfully used to treat and prevent cardiovascular disease and diabetes. The fact is, low testosterone in men is associated with increased heart disease and mortality from all causes. Myth number 7, testosterone causes liver damage. Although high doses of oral synthetic testosterone are absorbed into the liver and adversely affect the liver, bioidentical testosterone pellets, gels, and patches bypass the liver. So the fact is that there are no adverse effects on the liver enzymes, or clotting factors. Myth number 8, testosterone may increase the risk of breast cancer. As early as 1937, it was recognized that breast cancer was an estrogen-sensitive cancer, and testosterone was antagonistic to the estrogen and could be used to treat breast cancer as well as other estrogen-sensitive diseases. The fact is, testosterone is breast protective and does not increase the risk of breast cancer. Myth number 9, the safety of testosterone in women has not been established. There's hundreds of excellent studies on the safety of testosterone therapy in women. The fact is, testosterone pellets have been used safely and studied widely since 1938. Myth number 10, finally, testosterone causes aggression. Although anabolic steroids can increase aggression and rage, this does not occur with our bioidentical testosterone therapy. The fact is, testosterone therapy decreases anxiety, irritability, and aggression. Thank you for joining me here today. I hope to see you all at LowTE, Florida. Remember to listen in on Thursdays at 7 p.m. for Let's Talk Hormones with Carolyn Zallmeyer. See you next week. Thank you for listening. It's my mission to help men and women live their best lives, and I hope that today's show gave you just a little motivation to do so. If you'd like to learn more about bioidentical hormones and if they're right for you, please call my office to schedule a consultation, 954-791-4498, or visit our website, lowteflorida.com. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.